much, every one of you know what the mammography is. Tell me, who doesn't? We're all terrified, every year or every 2 years, we have to go and, do this crazy thing that, is hurting us done for weeks, right? But there is an alternative. I want to invite, my friend, Lisa Mack. She's going to tell us about really cool technology that is helping us actually to, she's helping the early detection of the inflammation, of, the different, tumors, which, might be more even successful than mammography those days. So let's welcome, Lisa.
Thank you, everybody. My name is Lisa Mack. I'm a certified clinical thermographer. I've been doing thermography for about 4 years now. I went to school to study nutrition, and when I was in school and we were talking about radiation, and there was like, well, how harmful radiation is, and I asked like, well, what else can we do? So they said thermography. So I'd never heard of it in my life, and I was like, okay, so I was determined to find a facility for me to get a thermography done, and I did. And when I went and got it done, I got my report back. I was very intrigued by the whole technology. So then I got affiliated with some doctors to read the report. I bought the camera, and here I am today. I'm a mobile thermographer, so I'm in 9 different locations. So I'm the person that takes the pictures, and we have a group of medical doctors that are trained in thermography. They're able to read it. They're thermologists, just like a radiologist, they're thermologists. So basically, I send the report back to them, and they read the report, and then it comes back to me, and then in turn, I send it to you. So with the report, the results, it's great. It's a medical report, and it has your medical terms, but it also has your layman's terms, so you to understand the report, and also for suggestions that you should be making to make yourself better, to make those changes. So I'm going to present to you this presentation because thermography is very hard to explain, but you need to see it. So we have welcome to medical thermography. And what is thermography? If you're alive and breathing, you're an infrared being emitting infrared energy 24 hours a day, every day of your life. So what does that mean? So medical thermography sees your body functioning in real time. Whatever's going on in your body at that moment, it sees it. Red and white patterns mean inflammation. If you can see in the center of the back there, the red and white, that means inflammation. Inflammation is a very active cause of cancer, diabetes, arthritis, cardiovascular, and much more. So our bodies gives us clues. We have symptoms. We have fatigue. We have digestive problems, foggy thinking, pains, anxiety, and depression. So what do? We go get blood tests, MRIs, X-rays. We get a medical evaluation. We get sometimes invasive tests, surgery, or we get drugs. So there's a different way to this approach. We can go the traditional way, where you are the patient going to the doctor, and you're really getting disease management. Then we can go to the thermography, where we really see it's very, very safe, it's non-invasive, and we're really monitoring your patterns in the body of the inflammation of really what's going on. You can see actually everything. So this is ancient thermography mud testing. Actually, thermography's been around since 1952, and it was FDA cleared in 1982. But like for practice, they used to use mud on their body when that one spot would be warm, just like it's showing on the thermogram. You can see the mud rise up. So thermography is in the industry, law enforcement, the military uses it. And I'm sorry I'm kind of going through this fast because we're out of time. Afraid. How can thermography help you? Inflammation is a really normal healing response. We can see here that this person here has a sinus infection. You can clearly see it between the eyes and above the head. So how can thermography serve you? We can identify your health challenges. We can help you clear your thermal patterns, and I'll explain what that means. Health guidance, monitor treatment, and monitor healing. When we see help you clear your thermal patterns, the thermography has patterns that we see. Sometimes it's, vascularity or toxicity and just different things going on. So when we make those suggestions, things that you should be doing, we want you to come back, and when you come back, we actually can compare your report, and you will see for yourself that inflammation that was there is no longer there. So fighting inflammation, we focus on diet, detoxification, balancing, massage, other modalities, plus stress reduction and reduce inflammation. As we know, eating an anti-inflammatory diet, of course, will reduce our inflammation. So top causes of death in women. Many women think that, they hear breast cancer, it's the number one. And it is not. If you can see it down there, right over here, right down here, heart disease is number one. So what's your breast health plan? What's your breast cancer plan? So this is here. We have a thermogram. Okay, we're monitoring the heat, which you can see in this breast and there. Heat obviously is inflammation. So what exactly is going on underneath that inflammation? A breast cancer plan begins with a mammography. There's 55% false positive rate than overdiagnosis. So it's an unnecessary and over treatment. So this is a normal mammogram where you're taking your breast and putting in between those metal fold plates and getting it squished. Then you can come in and see me, and this is what it was. You're posing in front of a camera. That's basically it. The camera is right here. It's an infrared camera. You sit in front of the camera when you're doing your breast region, and we just actually do different angles, and we also do a full body screening and a health screening from the head down to the hips, and that's both for men and women. Thermography, oh boy. Okay, sorry. Thermography can see breast inflammation. You can see that here, okay? What can be done once it's detected? Then if there's something that can be done to make a difference, yes, there is. It's called breast clearing. So we'll get into that a little bit more. Okay, so thermography can detect inflammation, an unhealthy hormone pattern. This is before breast clearing, and this is after. So if you look at the one before, that's a hormonal imbalance. And if you can see all the specks of the red, that's called a modeling pattern. When we see that, that's a hormone imbalance. So what do? We send them out and tell them to get their hormones checked, get in balance, and when we come back and see them, this is what it looks like. Let's clear it up. Okay, so thermography can see lymphatic congestion. And you can see here, there's the lymphatics right over here. You see all that inflammation. That's a sluggish lymph. Now, a mammogram does not detect inflammation, and it does not detect lymphatic congestion. Whenever you come into the office, the first thing I teach you how to do dry brushing. And you'll see that more in here, and how to clean out the lymphatic system and keep the lymphatic system moving. Okay, so breast and lymph system. Here you see this patient was diagnosed with breast cancer. Okay, and then the lymphatic system here plays a formation of neoangiogenesis, which means a growth of a new blood vessel. So if you have clogged lymph glands, you're really just waiting for disease to happen. So it's very important to keep your lymphatic system moving. So this is imaging of the head and neck thermography and breast thermography. And here we have dental problems causing unknown infection. Okay, now if you look at here, you can see this mouth here is loaded with inflammation, and it's dripping down into the neck and possibly into the lymphatic system. So when we see something like this, we send them to Dr. G. Yeah. No, and I had someone come in for a thermography, and she was getting a breast thermography done, and she said, "Can you shoot the side of my face?" She said, because she didn't have much symptoms, but she had a root canal, and she was having like brain fog and just different things happening. And sure enough, it was impacted. It was when I sent him to Dr. G. It was impacted. The inflammation went all the way back and all the way down into her neck. It was clearly infected. So here we have some liver challenges. This is a hot flash before and after. If I'm doing a thermography on a woman and all of a sudden a hot flash happens, this is exactly what I see. I'll just have to wait for it to pass before we take the image. So this is back pain. This is RCD. This is a patient who was diagnosed with SD, And what they're doing now is you can clearly see how the hand here has no blood flow whatsoever. You see the dark? It's absolutely cold. So I just got back from a thermography convention, and they're actually saying that they're using thermography to diagnose RSD because you can see it I can clearly see it. And one of our thermographers actually works for a doctor that does this. So they use, this is complex, somebody, I just had it go in my head. No, you know, I'll tell you in the end.
Okay.
I had it all down, just lost my train of thought. Okay, so this is food allergies, food intolerances. So when you come in for a thermogram and we see something like this, see those modeling patterns again? Okay, we send them out for a food allergy test, they change it, and this is what it looks like. You see the carotid artery, the flame happening in the carotid artery here. Okay, chest dysentery and potential heart disease. You see the blue there? That's exactly what we send them. When we see that blue, we have them say, okay, you know, do you have symptoms? What's your symptoms? And I had a patient that had exactly this. And she was experiencing back pain, trouble breathing every now and then. So this is early signs of something going on. So you're seeing things in your body that you don't even know that's happening. So this is a very good thing for you to get done. And then you can actually see early enough to make those changes to make it all better. This is what lower back spinal fusion looks like. This here is a broken foot, and you can see the broken foot here. And it's actually pulling, and you can see the right foot is pulling. It's actually pulling on the other side to heal that foot. That's why that foot is actually colder. You see all these temperatures? This is what the doctors do. You will never see that on your report. The doctors measure temperatures in your body to see how hot things are, or the indication, so they tell from one side to the other. But that you'll never see on your report. So that's what underneath the foot look like. This is the broken foot. Again, sinus pain. This is rosacea, what rosacea looks like under the thermography. And then this is the hand glove. This is when we see this. This is possible sugar imbalance. So if I shoot that and I see it myself, I'm like, oh. So a lot of times people don't even know that they have any kind of sugar intolerance, and this is imbalance, and this is what it looks like. Thyroid, you can have weight gain, hair loss, hoarse voice, all these different things, and thermography can see your thyroid asking for help. Well, long before it's even diagnosed, so here's your thyroid. You can see that thyroid all red. Digestive complaints. Breast implants is a very safe for breast implants. This is the dry brushing I was talking to you about. I only have a few more minutes, so I'll be downstairs to answer any questions. And this is what will help you clear out the implants. This is just a product we use for women that they can use for their fibrocystic breasts. And of course, if you have a hormonal imbalance, this is just an example of a natural progesterone, testosterone cream to help with your body balance. And then this is how you know your breast clearing is working. With the dry brushing, this is before and this is after. You can clearly see the red, and then it's less on this side. This is a full body thermography, what it would look like. And say yes to thermography.